Good morning. Our class starts at 9:30. This is almost 9:28. Trying to see if the setup is perfect, if sound is okay, and please let me know if there is any problem with the sound or the lighting. Now, at this time of our social distancing and self-isolation, we as a yoga community also have a responsibility to share with our community how to fight with this coronavirus with our yoga practices. Now, today, my teaching will be fighting coronavirus, improving lung function with yoga practices. We all know by now that coronavirus lives only in a human being or another live animal. The coronavirus primarily affects our lung. It attaches to our lung tissue, it starts multiplying, and it creates an inflammation of the lung. And the inflammation of the lung, most of the cases are very mild and they resolve by itself. And as a long-term outcome, there could be some pulmonary fibrosis, which you call a scar tissue of the lung. When the oxygen exchange becomes a problem and people do suffer with a shortness of breath. Now, other people with a underlying chronic diseases or underlying lung diseases or immunocompromised patient, that lung infection can progress to a septicemia, like an infection in the blood, creating a septic shock, then multiple organ failure, and that's the terminal event for a patient from the coronavirus. So if we can improve our lung function and lung health, hopefully it will be a tool, yogic tool, to fight the coronavirus. Now, as all of you know, in yoga practice or in a yoga therapy practice, there is no a yoga for a cause or for a disease. That means yoga as a therapy is not a reductionist approach. It is a holistic approach. We want to improve your overall health and well-being so you can fight this coronavirus. Now, but with our extensive practices, like as my friend Timothy McCall, he's another physician and a yogi, came up to a term, it's called reductionist holism. That means we know by now that there are some yoga practices which is specific for a different condition and different diseases and different organs. Another important yogic consideration is why we are so concerned about our lung function. As all of you know, pranayama, the fourth limb of the Ashtanga yoga, these 8 limbs of yoga, is the healing substance for our body and mind. Now look at this scenario. A person who is dying, what are the steps of death? We call a person expired. Expired means he or she had the last breath coming out from the lung. And when the lung stops. When the lung stops, then the heart stops. When the heart stops, your neurological function stops. When all the vital organs stops, then our cellular function stops and a person is declared as a dead. So if you improve a lung function, you are going to improve your heart function or cardiac function, your neurological function, and your cellular function. And that's the reason we are so interested about improving our lung function. Now, one very interesting concept about yoga therapy is that we are not interested about the disease you have, we are interested about you as a whole person. So we'll be talking about more and more what else we can do to improve our lung function. Now, before we start our practice, let me share with you few physiological parameters for our lung, some functions of our lung, so you will understand what we meant by improving lung function. Lung has a tremendous amount of reserve. So giving you the number, which is just an average number, it varies from men, women, and different person, but average number. Total lung volume is about 6 liters. So about 6,000 cc. The amount of air we breathe in and out in normal breathing, which is called a tidal volume, is about 500 cc. 0.5 liter. So think about it. We have almost 12 times of the reserve in our lung. Now then the other parameters which you can look very carefully in the lung physiology is that called inspiratory reserve volume. What does it mean? It means after my tidal volume, the amount of air I can breathe in, and that is almost 3 liters, 3,000 cc. So these two, inspiratory reserve volume and tidal volume, constitutes called inspiratory capacity. That means amount of air I can breathe in with a practice. And also there is called expiratory reserve volume. Like after my normal breathing, that tidal, my normal 500 cc tidal volume, how much extra I can breathe out. That is almost about 1 liter. So if you look at the numbers, 3 liters inspiratory reserve volume, 0.5 liter is a tidal volume, 1 liter is expiratory reserve volume. Now we end up with 1.5 liter, which is called residual volume. This residual volume, 1.5 liter, always stays in the lung. That we cannot even remove, or that I cannot do with any kind of practices or in expiration. Why? Because lung needs that 1.5 liter residual volume to keep itself open. So beyond that, in a pulmonary function test, in our Western medical concept, we talk about called FEV1. It's called forced expiratory volume in 1 second. In fact, that is regarded as the benchmark, gold standard of the lung function. Not even lung function, it is regarded as a benchmark for our overall health and well-being. So, forced expiratory volume in 1 second means after taking a deep breath in, how much air I can force out in 1 second. Normally, it's about 1.5 liter. And that's generally about 50 to 60% of the air I can forcefully breathe out, which is the forced residual volume. So when we start increasing our FEV1, our lung function gets better and better. So when you look at all the numbers, the lung has a 1.5 liter of residual volume, which we cannot remove at all. Lung needs that to keep itself open. We have another 4.5 liter, which is called a vital capacity. That means we have a 4.5 liter volume in the lung, which we will be able to exchange between inspiration and expiration. So think about it. Normally, I'm breathing only 0.5 liter, and I have a reserve of 4.5 liter. And that we are going to improve, they are going to tap with our yoga practices. So I'm going to go over with you the yoga practices this morning. But before that, let me go over with what we'll be going to do to improve our lung function. Now, in my last class, I talked about and did a class improving lung function and immunity. And at that class, I have explained that the lung and the breathing mechanism is from the muscles of respiration. And the muscles of respiration is attached to our chest, to our back, and all of them are attached to our upper extremities. So, able to improve the strength and balance of the upper extremities will able to improve our lung function. And then the muscles of respiration are called skeletal muscles, and they can be trainable. Like, for example, like my biceps muscle here, which is a skeletal muscle. So if I start doing a weight training, I can do a weight training with 5 pounds or 10 pounds. And after repeated practice, we develop a phenomena which is called neuroplasticity, or called habit forming. That my muscle is now trained to able to use 10 pounds. So I can go back now to 15 pounds. And after a while of this practice, again, when neuroplasticity sets in, I can go over the 20 pounds. Same thing is in the lung. What I'm able to breathe today. So the breathing of the lung, primarily yogic breathing, is first exhalation. Remember, lung is like a balloon. It is full of all the air and gaseous exchanges. Now, if you start taking a deep breath in, this air is sitting in the top of that lung volume, which is primarily we call a dead space. So in all yoga practices, you have to learn how to breathe out first. When you can breathe out first, then you breathe in effortlessly. All the yoga practice, in all the pranayama practice, you do not make any effort. So what you do, what we teach in yoga is that in stages, impossible become possible. Today, you may be able to do 2 seconds in and 4 seconds out. We always in yoga practice, exhalation is longer than inhalation. And the reason is two. The first, when you do a more exhalation, you create a more space and your tidal volume becomes more and more. So normally, like I can breathe in and out only 0.5 liter, but with the very simple yoga practices, it could be even a 1 liter, 1.5, even 2 liters. But remember, do not do any forceful breathing technique or pranayama technique. It has to be totally effortless. This is not competitive. You are not competing with anybody. You are only competing against yourself. So as we explained in the last class, a relaxation of the whole upper extremity helps you breathe effortlessly. Say, for example, we'll be practicing again, but just to give you an overall, called the Bellows Mushti Mudra. Bellows Mushti means the hand gesture by the baby, called the Adhi Mudra, putting a thumb inside and close. When you do it with breathing, like you breathe in and breathe out, it relaxes your hand. Wrist gets relaxed with extension, wrist gets tightened up with flexion. So we'll be doing extension and flexion with our breathing technique. We'll do a wrist extension by putting our hand and slowly putting in the ground. There's a relaxation of the wrist joint. Shoulder joint will be called Skandha Chalanasana, putting a hand together and slowly rotating our shoulder. We'll do it. Just giving an idea of what we're going to practice. Neck gets relaxed with called Brahma Mudra. Brahma Mudra is a 4 steps of neck movement with a breathing. When you breathe in, drop your neck to the back, and breathe out, put your neck in the front. Then you breathe out first, breathe in the middle, drop your neck to the one side. Same breathing cycle, come back in the middle, go back to the other side, and same breathing cycle, come back in the middle. With the breathing. Breathe in the middle, go all the way to the back without turning your shoulder. Then same breathing cycle, come back in the middle. Breathe in the middle, go all the way to the back without turning your shoulder. And finally, drop your head down, breathe out first, take a deep breath in, and slowly rotate your shoulder, your neck. So we'll be practicing that, just to give you an idea. Whole upper extremity gets relaxed with called Paschim Namaskar, prayer pose to the back. We take our hands to the back, putting like a prayer pose, and slowly keep our prayer pose, keep our eyes closed, and we breathe in and out. When our spine gets straight, a relaxation sets in. That is a primarily yogic relaxation. Because the muscles in the back the paraspinal muscle keeps us very tight to keep us straight. So we ourselves, every yoga posture, the asana for a therapeutic yoga is called Sthiram Sukham Asana. Sthiram, stillness. Sukham, happy. Asana is a pose. But primary component of Sthiram Sukham Asana is the straight spine. Merudanda Achal and Manasthir. Mind is very quiet and spine is very straight. Relaxation of the a west area in the upper part starts with your called Yoga Mudra. Put your hands in the back, take a breath out first, take a deep breath in and slowly start coming down as far you can come down. Follow your body's response. What is the body's reaction? First is pain. You should not cross the limit of your pain. When you cross the limit of your pain, you are creating an imbalance. And also, if you create an imbalance in your physical body, it shows up in your breath. It's called Pancha Kosha model. Annamaya Kosha to Pranamaya Kosha. Any imbalance you create in your physical body, it shows up in your breath. So as long as your breath is effortless, as long as you don't have any pain, you progress slowly. Lower extremity gets relaxed, like a feet get relaxed, when you're able to separate your toes. We'll do it. We use our finger to separate our toes. Relax your ankle joint, relax your knees, hips. We'll show you the practices, what we do. But primary relaxation for the lung function comes from the upper part of the body and the neck. Look at hand. Hand is also very important. You'll see the hand power. What you will do, you will do a very simple called Tulasana. We put our hand and raise our body high up. Called Kukkutasana, cock. Put your one hand here, one hand the other way, maybe Ardha Kukkutasana, and I'll show it to you, those asanas. Those are very, we call it advanced asanas, but for us, there is no advanced asanas. When you start doing a relaxation and able to follow your breath, all the asanas will come to you. Bakasana, crane, putting a hand here, lifting your body high up, a powerful tool. Mayurasana, peacock pose. A Mayuriyasana, we call a female peacock pose. There is a very advanced asana called Pangu Mayurasana, called wounded or a lame peacock pose. I'll try to show all of them to you, but for you not to practice because it will come to you. Once your hand strength and relaxation sets in, then you start doing some practices of the lung in stages. So what does a stage means? The first stage will be, again, able to breathe out first, breathing effortlessly. Maybe today you'll be able to breathe in, count of 2 in, 1 and 2 in. Then able to breathe out, count of 4 out. 1 and 2 and a 3 and a 4. It takes about 30 to 40 inputs in the brain to create the neuroplasticity. So it's not going to happen overnight. You need to do a consistent daily practice. So what happens? I'm sitting down here. I'm not trying to sit down. My brain is allowing me to sit down. Same thing is going to happen to your breathing. When your brain will figure it out that you can breathe a count of 2 in and count of 4 out effortlessly, you'll be able to do count of 3 in, count of 6 out. Count of 4 in, count of 8 out. For us, we've been practicing for so long, we can do count of 10 in, count of 20 out. And believe me, I have sat down with the yogis, and when they're breathing, there is no sound even. You don't even they're breathing. They're breathing 2 breaths a minute. maybe 1 breath a minute. It's amazing what the practice will do to you. So for us, very easily, we can do, say, a 6-second in and 12-second out. So 18 seconds. So almost can cut down to 3 to 4. Or just get a 4-second in, 8-second out. That is the first practice. Exhalation twice the inhalation. Next practice is when you are relaxed, is called a dirgha shwash. Dirgha shwas, dirgha means long, shwas means your breath. Dirgha shwash in a yoga practice is called a 3-stage breathing. Our lung has the 3 lobes: lower part, middle part, upper part. So what you do when you breathe in, you will breathe in 3 steps. So first you'll fill up in the lower part, in the middle part, then the upper part. And when you breathe out, you'll also do 3 stages. First is the upper part, then the middle part, then the lower part. It's the same concept of like putting something in your bottle. If you put a water in a bottle, it goes to the lower first, then the middle first, upper first. When you remove it, it goes from the upper first, then the middle first, and the lower first. So dirgha shwash, like for example, we'll be practicing, but just to give you one demonstration, you breathe out first. See, when I'm breathing in, I'm taking 1 part, 2 part, 3 part. Very important second practice. Third practice to improve the lung function is going to be your breath holding. And breath holding is slowly comes with your practice. A simple breath holding is called Sattvic Pranayama. What is Sattvic Pranayama? Sattvic Pranayama is inhalation, like breathing in, and holding your breath in inhalation, which is called retention. Then do the exhalation, breathing out, then hold the breath again, is called suspension. So inhalation, retention, exhalation, and suspension. Primarily in Sattvic Pranayama, the ratio is 2:1:2:1. What does it mean? So in Sattvic Pranayama, you start with the breathing out first, then take a breathe in with a count of 4 in. 1 and 2 and a 3 and a 4 in. Then hold your breath for a count of 2. 1 and 2. Then breathe out again with a count of 4 out. 1 and 2 and a 3 and a 4. Then hold your breath in suspension. Count of 2. 1 and a 2. So what you have here, breath holding both in inhalation and exhalation. And slowly start increasing. 6:3:6:3. 6 second in, 3 second hold, 6 second out, 3 second hold. And slowly increasing. I have seen yogis or you can siddhis who are able to do maybe almost 24 second in or 32 second in, then 16 hold, 32 second out, 16 hold. But those are extreme yogis. But we can do very easily 12 seconds in, 6 second hold, 12 second out, 6 second hold with our practice. So third component is Sattvic Pranayama to improve our lung function. Fourth is a breath holding both in inhalation and exhalation along with your locks called bandhas. Okay? So the locks are primarily very calming, cooling, quieting practice. See, we'll be again practicing, but just give a little demonstration. The first lock is called a chin lock, Jalandhar Bandha. So what you do, you keep your neck straight, do not drop your neck. You breathe out first, take a deep breath in, then hold your breath and slowly drop your chin down and let the chin come close to your chest. This is in yogic tradition called a Murcha Pranayama. Murcha means unconscious. It is so relaxing, so calming, so cooling, it feels like almost you are passing out. Then you hold your breath as long as you can, effortlessly, then let go. So what it is, when you start touching your chin to the chest, you have a two functional organ here is called the carotid sinuses. Carotid sinuses, when get massaged, it has a very calming, cooling effect on your cardiovascular system. So it massages your carotid sinus. It also has a lot of other physiological changes, and it's incorporating your breath holding in inhalation called Abhantarin Kumbhak. In yoga practice, inhalation is called Puraka. Breath holding is called Kumbhaka. And breathing out is called Rechaka. Next one, you do breath holding in exhalation. In a breath holding and exhalation, you incorporate abdominal lock called Uddiyani Bandh. So the way you do the Uddiyani Bandh is that you breathe out first, take a deep breath in, completely breathe out, suck your stomach in and hold. Then let go. We'll do a little bit more practice. But just to let you know, don't think about how long you can hold now, today, because you'll be able to do it better and better holding as the time goes by. For us, say breath holding in inhalation, for our long practice, we can do very simply 20 seconds, 40 seconds, 45 seconds. A good yoga practitioner can do almost 1 minute. I've seen yogis who could do about almost 2 minutes. And the people who can do longer breath holding and inhalation is the divers. Duburis, divers. When they go under the water, they hold their breath. Some of the divers can practice and can do almost 8 minutes of breath holding. Breath holding and exhalation, generally about 15 seconds, count of 15, 20 seconds is great. Then you have other locks, is called the root lock, Mula Bandh. Again, you breathe out first, take a deep breath in, breathe out, and hold your breath, contract the whole pelvic floor, inhale sphincter, and pull it up. And also what part below your belly button is called your root lock or Mula Bandh. Then you can do all the three bonds together. Jalandhar Bandh, Uddiyani Bandh, and Mula Bandh, which is called your chin lock, abdominal lock, and the root lock is called a Mahabandh. We'll do the practice again. And then is very important yogic practice is your alternate nostril breathing called Anulom Vilom Pranayama. In alternate nostril breathing, you use your one hand, also do your mental relaxation. This is called your Gano Mudra or Dhyana Mudra. Touching the index finger and thumb, put it over your left knee. Use the right hand, close your right nostril. You don't have to shut it down, just close gently underneath your right nostril. Breathe out through your left nostril. Then breathe in through your left nostril. Drop your hand down, close your left nostril with a ring finger and a little finger. Then breathe out through your right nostril. Then you breathe in through your right nostril. Drop your hand down, close your right nostril and breathe out through your left nostril. This is the alternate nostril breathing. It improves your lung function. It activates your both sides of your brain. The left nostril is controlled by the right brain. Right nostril is controlled by the left brain. It also opens both of your nostrils for proper breathing. Normally, you know that one of our nostrils is less open than the other side. And it, in a cyclic way throughout the whole day, it varies from 90 minutes to 2 hours. That one nostril is opened up. And I've seen yogis, what they do, the nostril which is not open or less open, they lay down in the opposite side. If the left nostril is not proper open, they will lay down on the right side. It will open their left nostril. Another one they use called Yoga Dand. Yoga Dand I have seen, it's like a stick and there is a small area of curved area and they put underneath there your this area. Okay, so what it does underneath here, they do the opposite side of the nostril. Okay, if the left nostril is closed or halfway blocked, they will use the armpit, the right armpit. They will put the Yoga Dand under right armpit and they will wait for a while. And I have seen practically it opens up other part of the nose and both the nose opens up. And I have seen yogis just have nothing. They'll be, living a life with a small container to drink water, offerings from other people, but they always carry this stick called Yoga Dand, which opens their nostril. And look at all the yogis, how long they live. They're tremendous amount of longevity. So one very important practice for improving lung function is your Nadi Shodhana or channel clearing. It is done with a breath holding with alternate nostril breathing. So what you do, the way to do it, you use your again left hand with the Gano Mudra or the Dhyana Mudra. In a right hand, you do call a Vishnu Mudra. In Vishnu Mudra, you drop your index finger and middle finger towards your palm, and with your ring finger, little finger, and thumb, you create a pinch. And then you put a pinch on your nostril, and then what you will do, you will incorporate a breath holding. And the way it is a ratio of 1:4:2. So if you close your right nostril, you breathe out through your left nostril, you breathe in through your left nostril with a count of 4 in. Remember the seconds, that's how we count. 1 and a 2 and a 3 and a 4. Then you hold the breath for about 16 count, 4 times. Then you breathe out, then you close your left nostril, you breathe out to the right nostril with a count of 8. Breathing out. So 1 breathing in, 4 breathing hold, 2 breathing out. Then alternately, again, you will breathe in through your right nostril with a count of 4 in. You hold your breath for count of 16. Then you breathe out with a count of 8. And for us, we can do a lot more because we've been practicing for a long time. But count of 4 and count of 16 and count of 8 is very easy to do. So let me give you one demonstration, then you will understand. So here I am. I'm closing my right nostril. I'm breathing out through my left nostril first. I'm breathing in through the left nostril with a count of 4 in. Then I use my pinch to close the nostril with a count of 16. Then I breathe out through the right nostril with a count of 8 out. Breathe in through the right nostril with a count of 4 in. Use the pinch to hold the breath for a count of 16. Breathe out through the left nostril with a count of 8 out. One round of Nadi Shuddhi Pranayama. This is a very powerful tool to improve the lung function, and we've been practicing for a long time. We can do 8 seconds in, 32 hold, and 16 out, very easily. Then other pranayamas, which are very important to improve lung function. The first one is called Bhastrika, or the Bellows, which is an active inhalation and active exhalation. And the whole yoga practice is based on one principle and theory, is going against the grain of your habit that we learn from our Ayurvedic practice, that like always hurts like. Like if I have all the qualities of Vata, I have to do opposite. I have to have attributes of Kapha. So my normal breathing is active inhalation, passive exhalation. So I will do active inhalation, active exhalation, like a bellows. We do a lot of ways. We do with the raising shoulder, raising our hands, and do the practice, and that is called Bhastrika or Bellows. And we slowly build up our Bhastrika practice. We could do at the present time very easily about 4 to 5 minutes of Bhastrika. Bhastrika creates a hyperventilation syndrome. So you have to be a little careful when you start first doing a Bhastrika pranayama, because Bhastrika will give you a sensation of hyperventilation, which is an altered sense of consciousness, circummoral numbness, carpopedal spasm, a lot of peripheral symptoms. So you have to do it very slowly, the Bhastrika pranayama, at least effortlessly. Kapalbhati pranayama, forehead, we call it a forehead shining. So that is active exhalation, passive inhalation. I have a balloon here, I have a diaphragm here, another balloon here. So I just bring my awareness to my belly button, push the belly button to the back, and air comes out. I don't breathe. All my concentration is here. Why? I never need to learn how to breathe in. The day I was born, I took a deep breath in. Nobody taught me how to breathe in. I need to learn how to breathe out. So this is an active exhalation, passive inhalation. It has a tremendous amount of physiological effect. It removes all the toxins, is a detoxifying pranayama, but it massages all the internal organs. Every time you hit, it massages your liver, massages your stomach, massages your colon, massages all the intra-abdominal organs, but also it massages your diaphragm, massages your lung. So when you are feeling the air, massaging your lung, massaging your heart. The heart is laying in between your lung. And yogic tradition, when you massage an organ, the organ gets better and better. And really in our medical practice too, somebody has a cardiac arrest, we do a CPR, cardiopulmonary resuscitation. What is CPR? External compression on the heart. Massaging the heart. So here you're massaging the lung, improving our lung function. Bhramri pranayam, bumblebee breathing, which we'll be practicing. Ujjayi pranayam. You know, in a bumblebee breathing, what we do first, we shut down all of our senses. We have 5 senses. We hear, we see, we smell, we taste, and touch. Close our eyes, close our ear, close our mouth, and then our brain is in a state of frequency, and we create another frequency. 2 frequency interacts, and it creates what a harmonic resonance. Our mind quiets down. When the mind quiets down, we breathe better. When the mind quiets down, my anxiety is gone, my panic, my fear is gone, which is very harmful for our immunity. Our immunity gets better when I don't have the panic, fear, and anxiety. So just like the way we do it, put your finger, index finger in, 3 fingers to close our eyes, a thumb to close my ear and close my mouth. I breathe out first. Take a deep breath in. Breathe out with the sound of a bee. We'll do practice again. Ujjayi pranayama. Able to close your throat and trying to breathe in. But this closure is very relaxed. It is not tightness of the larynx. You have to learn how to relax your larynx. What it does when you're able to close your larynx, try to breathe in, it stimulates the nerves in the larynx, which are called your superior laryngeal nerve and inferior laryngeal nerve, which are part of the vagus nerve. In vagus nerve, 80% signals are afferent. It goes to your brainstem. And then the signal comes out through cranial nerves, comes out through a called glossopharyngeal nerve and hypoglossal nerve. Glossopharyngeal nerve, your supplies the palatopharyngeus and palatoglossus muscle in the soft palate. It tightens up the soft palate. So it really controls your snoring. Snoring comes from the vibration of the soft palate. When the snoring is controlled, you sleep better. The signal comes from your hypoglossal nerve. Hypoglossal nerve is a nerve supplying your tongue. So the tongue is pushed in front. When tongue contracts, it gets pushed in the front. When the tongue is pushed in the front, it have your almost like a treatment for your sleep apnea. Because sleep apnea, the tongue falls flat. When your sleep apnea gets better, you breathe better. Your lung function gets better. So Ujjayi pranayama, like you were trying, the way to do it, again, you breathe out first. Say, I always use my Balo Mushti mudra. This is the mudra I always use my hand to bring the relaxation. I'll be breathing out first. Take a deep breath in. Completely breathe out. When you get a cough, it's entirely normal. That means you hit the right place. Always remember, we have called it accessory muscles of respiration. When you're using the accessory muscle, that means you're straining. When Ujjayi Pranayama is done very smoothly, you don't use your accessory muscles. Use a Om Pranayama, use a Sitali Pranayama, Sitkari Pranayama, Sadanta Pranayama, a Plavani Pranayama. There's a lot of pranayamas to improve the lung function. So after this sort of introduction, and I wanted to give introduction because this is going to be a video and you will be able to take a look at it and you will be able to extract all the information, especially for the yoga teachers and physicians, all healthcare providers, and to able to use them. And we know the effect of them in our body and mind because we have a parameter to use. This is Apple Watch. It is recording all my vital functions. Same thing we can do with the Fitbit or any other. So we know the effect of this yoga practice of vital function. So first, just very quickly, which you did in the last class, that we relax our hand, put our hands in front, breathe out first, take a deep breath in, breathe out, close your fist. Breathe in, breathe out. For the wrist, you do breathe in, breathe out. Breathe in, breathe out. I'm going to do a little quickly with this because all these practices are there on my previous class, which are also in the video, you'll be able to see. So if you look at the wrist relaxation, and initially you'll have a pain here. So if you have pain, you back off. If you don't have any pain, you have an effortless breathing, slowly and slowly you'll be able to come down here. Wrist gets relaxed. All the pain comes from the tightness. It'll go away. Carpal tunnel will go away. You feel better and better. Your shoulder, put your hands here, trying to bring your elbows together. If it doesn't, wherever it comes, if it comes here, breathe out first. Take a deep breath in. Slowly rotate your shoulder. And I do it generally with my eyes closed and keep on doing it. And always create a balance to the opposite side. Like here, breathe in, breathe out. I'm going a little quickly over just to show you the techniques, but you will be able to do it at home and you will see the relaxation will set in. You can put your hands all the way high up, hold your wrist, breathe out first, take a deep breath in, slowly push your hand, pull it down behind your head. But same breathing cycle, pull it up, breathe in, and then breathe out. Very beautiful practice. For the neck, again, for my hand, I always like a relaxation. In fact, even if I don't try to do it, my hand goes like this, because this is a powerful relaxation. That's why baby closes the fist. Baby is completely relaxed. That's why baby do it. Balo Mushti Mudra. So breathe out first, take a deep breath in, drop your neck to the back, and slowly drop your neck in the front. Listen to your body signal. What is that? Your no pain and effortless breathing. Slowly, you can do it. And also, there are 4 other steps. I'll show it to you. Also, you will notice it. I'm feeling so relaxed. What I can do, this is called Sukhasana, and I can also progress. I can put my one foot here. I put it in this posture. This is called Ardha Padmasana or Swastika Asana. So I keep it here because I'm relaxed. Second, in called Brahma Mudra. Breathe out first. Take a deep breath in. Drop your neck to the one side. And the same breathing cycle, come back in the middle. Breathe in the middle. Drop your head to the opposite side. And same breathing cycle, come back in the middle. Then you breathe in the middle. Look all the way to the back without turning your shoulder. You'll be able to see all the way to the back in the midline. And the same breathing cycle, come back in the middle. Look at the opposite side, all the way to the back. In the fourth step of your Brahma Mudra, drop your head down. Breathe out first. Take a deep breath in. Slowly rotate your neck to the left, to the back, to the right, and in the front. Always remember, health is a balance of your body, mind, and spirit. Always balance your physical body. So let's do the opposite side. Breathe in here. Slowly rotate to your right, towards your back, and the left, and the front. I hear all the time, I have a neck problem, I have a herniated disc, I have a spinal stenosis, I have a surgery before, I have a screws, bolts. Remember one thing, if you don't cross your limit, if you don't cross beyond your pain, if you don't cross beyond your effortless breathing, you won't be able to hurt yourself, as simple as it is. Always remember, do not take a pain medication and do a yoga asana practice, because your pain is telling you that you're creating an imbalance in your physical body. So you can look at it again, what I'm doing, the whole upper body get completely relaxed with a, call your Paschim Namaskar, prayer pose to the back. Put your hands to the back and keep it here, wherever you are. If it is here today, keep it here. But if it comes up, it is here. Breathe out first, take a deep breath in, and slowly you can put back in your prayer pose, Paschim Namaskar, and slowly we'll go up with your practice. 1 week, 2 weeks, sometimes it will happen. Once it happens, you feel a profound level of relaxation. In fact, the relaxation of your neck and your chest muscles is so much that you are able to breathe effortlessly. So if you can see me now, that I can go back to the balance, I can put my other foot on the top. See, I'm also doing it very gently in stages. This Ardha Padmasana of my other side. Okay? And then when I'm complete, as I said, I feel it, a sense of relaxation. I take my other foot in the top. I sit down in a Padmasana. In the lotus pose, what it is, it's a sign of the relaxation. Since yoga practice is not a reductionist, it's a holistic, which you will understand as a yoga practitioner that this relaxation is going to improve my breathing. Because this relaxation, it keeps my whole body relaxed, so I'm able to breathe out first, able to breathe in, and able to breathe out. Remember this thing. If you're able to do an exhalation longer than inhalation, you relax. You treat any kind of pain. Back pain. Back pain is not due to that herniated disc, spinal stenosis. It is due to irritation of the herniated disc or a spinal stenosis of a nerve, and it causes a tightness of the muscle spasm. So able to do this yogic breathing, exhalation longer than inhalation, you relax your back muscles. It's a therapy for your back pain, therapy for your hip pain, knee pain, and a chronic pain. Chronic pain is due to tightness of your physical body. Remember that when the cartilage breaks down, cartilage rubbing doesn't cause pain because cartilage is no pain fiber. But when a cartilage breaks down or arthritis, body causes splinting. What is a splinting? Splinting is the tightness of your ligaments, tightness of your muscles. All the pain fibers are there. Another sign of a good relaxation, the saliva in your mouth. Say I have been talking for almost 1 hour, but now I have any saliva in my mouth. So what does it mean? When you are stressed, when you are fearful, we're in a sympathetic response, fight and flight response. You get a dry mouth. But this relaxation is called parasympathetic activation. Our whole gastrointestinal tract is supplied by parasympathetic nerve. So parasympathetic nerve is called calm and digest. So I am having some saliva from my parotid gland. So my mouth is wet. I don't need to drink water when I'm relaxation response. Okay, so you can do, as I said, a yoga mudra. You can hold your hand back and slowly come down, and which I've shown it to you before. This is very nice, but let me show you a few hand strengths. So one very important hand strength is called Tulasana. Scale. You can put your hand here and slowly push your hand down, or whole body will go high up, and you'll be able to stay higher. This is your Tulasana. Hand strength and the hand balance, which improves your pulmonary function, lung function. Kukudasana. Let's start with the Ardha Kukudasana. Ardha Kukudasana, you put your hand inside of your leg, other hand outside, you push it here, and the whole body goes higher. Ardha Kukudasana. So you see, these are the hand strength. There's a lot of other hand strength. I'll show it to you. Let me show you first one little bit of a lower body relaxation. Lower body relaxation, you put your feet in the front. Your toes, if you separate your toes, breathe in, breathe out. With the breathing, your feet gets relaxed. You know, the market is full of it. Yoga toes, yoga socks, yoga shoes, but all the concept is separation of your toes. Relax your ankle with your breathing. You breathe in, breathe out. Breathe in, breathe out. Rotate your ankle with your breathing. Very nice. Or you call it a windshield wiper. You can just sit at forward bend and put your hands here. Wherever your hand goes, this head is okay. If it goes all the way down, it's good. You hold it. Slowly your head will come down. Again, listen to your body's signal. Don't push yourself. I can do it right away, but I'm showing it to you. Slowly you put your head down. There's no pain, effortless breathing, and head will come down slowly and slowly all the way down. When it comes down, you stay here. Between 5 to 10 breaths. Breathing out longer than breathing in. When you relax, when you come up, be sure, use your hand as a guide to come back higher. When you balance yourself, if you look at your feet and knees, you see that? Knee and hip get relaxed. So separation of the toes. I use my fingers. I use my finger to put in between my toes. I don't need a yoga toes, yoga sandals. Initially, the very tight finger was not going there, but now the finger goes in so easily. I put it up, breathe in, breathe out. Breathe in, breathe out. My feet all the way down. This is relax my knee joint and hip joint. Knee joint is the site of fear. Hip joint is the site of the emotion. Now, my knee doesn't come down, it's here. Let it be here. Do the breathing. Breathing out longer than breathing in, and this relaxation will set in. Always balance yourself. Bring the other foot high up. Put it here. Fingers in between. Bring your knees high up. Breathe in. And then when you drop it, it goes all the way down. This is a sign of relaxation. When you're able to do a relaxation in your body and mind, your lung function gets better. Your FEV1, forced expiratory volume, becomes more. Inspiratory capacity becomes more. Your tidal volume becomes more. Hip is a site of emotion. And all the emotions we have today with the coronavirus. So this is called a Titli Asana. The feet together, slowly bring it close together, Clamp your hand, put it down, and slowly you're just doing there is no, close your eyes. Keep your spine straight. You will see your hip joints get relaxed so easily. This is your Baddha Konasana, Sanskrit name, Titli Asana, butterfly, or just relaxation of the hip. Hypertension, blood pressure, is an emotion-driven disease. Relaxation of the hips will control your emotions. Total body relaxation is a yogic called your squatting pose, Malasana. You are able to sit down. In a Malasana, you look at this, you are relaxing your ankle, your knee, your hips, your back, and slowly you put your hands in front, separate your fingers. That's where the fingers get relaxed. And then you extend your wrist, put one elbow inside, other elbow inside. Keep your spine straight. Close your eyes and breathe in and out. You're in a profound level of relaxation. So we'll be practicing our pranayama practice, and we also do our daily routine. Daily routine, yogic routine, really helps you. Like we do a jalneti. Jalneti is your using a neti pot to wash your nostril. So think about the daily routine, dinacharya, which you do every single day. Wake up in the morning between 4 to 6. It is called a Brahma Muhurta, time of the Brahma. We sit down in a squatting pose, the Malasana. We drink a glass of water. Sit down for a while, your pelvic muscles get relaxed, we get a gastrocolic reflex, you get a proper elimination. And in yogic tradition, it says health is defined as a strong digestion, easy elimination, and a good night dreamless sleep. So to get proper elimination, you're healthy. The lung gets better. Brush your teeth, and in yogic tradition, take a finger, massage your gum. So any droplet, any bacteria, any virus, which is all there, these are all going to be drained out. We know the coronavirus sits in your throat for a while, maybe a few days. The tongue scraping. When you do tongue scraping, you're removing probably all the droplets. Jalneti. When you use a neti pot, put it through one nostril, close your eyes, breathe through your mouth, just relaxation, the whole water comes out, you flush your nose, and then all the water, you do a little bit of Kapalbhati Pranayama, all the water comes out. It's a beautiful daily routine. These are the routines you don't do when you have a coronavirus, when you have a flu. It is your daily practice. So that virus doesn't come to you. So for a hand strength, if you want to see a just simple hand strength asanas, that how to do it, Bakasana. Put your hand here, support your elbows, very simple. Put your hand down and slowly your body will go high up and will stay high up. So what do, you don't push yourself. Slowly goes high up, stays high up, and you stay here. So this is your Bakasana. Or you can say Mayurasana. If you want to see a Mayurasana, let me see if I can be within your frame. You put your hands here. Then just bend your elbows, put your body on the elbows and push your head in the front. And your whole body is going to go higher. Part of your hand strength. You can do Mayuri Asana. can do your Padmasana, lotus pose, and then you do your Mayurasana. Mayuri is a female version of your Mayurasana. So you do your lotus pose first. With practice, everything comes to you. It's not that I'm trying to do it, it came to me. So go there, again put your hand like a Mayurasana, put your hands on the elbows, push your body in the front, the whole body goes up and stays like that. Okay. Now, coming back with the practices which you talk about first, with your relaxation, also you create another relaxation on your practice. And the best relaxation for me, even it is a subconscious, is a Adhi Mudra. All the mudras in your hands, remember, hand is connected through your mind. Everybody talks with their hand. Even a broadcast journalist will have a microphone here, and hold it, and this hand will move like that. So the health in your hand of the 5 elements in the universe. Body is made of 5 elements: space, air, fire, water, earth. Space is the middle finger, air is the index finger, fire represents thumb, water represents little finger, and the ring finger. When you touch your index, it's a Gano Mudra or Dhano Mudra, it quiets down your mind. Index finger down, put a thumb in the top, Vayu Mudra. Quiets down your Vata, controls your pain. Touch your middle finger and thumb, called Shunya Mudra. This improves your hearing. Touch your little ring finger and thumb. This is your Prithvi Mudra. Very good for obesity, diabetes. Little finger and thumb, Varun Mudra. Improves your bladder function, fluid content of your body. Little finger, ring finger, and thumb, called Shakti Mudra. Improves your strength. Middle finger, ring finger, and thumb, Apna Mudra. Pachan Mudra, digestion Mudra. Clears out everything from your body. Put your index finger down, called Apna Vayu Mudra. This is for your cardiopulmonary function. Linga Mudra. You can put your finger there, thumbs high up. The babies do it all the time. It removes your phlegma. So this Gano Mudra, or Dhana Mudra, if you put your hands down, this is called your Chin Mudra. It improves the lower part of your lung. The lower part of the lung always gets properly perfused and properly ventilated. So if you put your fingers down, this is called Chinmaya Mudra. It improves the function of your middle part of the lung. Middle part of the lung gets some of your exchange of gases. What doesn't get exchanged is your upper part of the lung. Upper part of the lung is generally not being used. And that is get opened up with your Adhi Mudra or Balamushti Mudra. That's why I said I always do it the Adhi Mudra. My upper part of my lung to be open and functioning. So the first one I say, you do, and generally you do the pranayama with the eyes closed. So breathe out first, exhalation longer than inhalation. So practice count of 2 in, count of 4 out. Count of 3 in, count of 6 out. Count of 4 in, count of 8 out. Count of 5 in, count of 10 out. You can continue at home, and as long as you don't have any effort. If any effort, you stop. And in that place, you keep doing it at that level, it will get better and better. Dirghashas, 3 steps breathing. Always practice 3 steps breathing. So again, you breathe out first. You can clearly see that your 3 part of your lung getting filling up. I've always seen the people who comes to my class and practices, at the beginning I could only fill up lower part of the lung. After regular yoga practice, now I can fill up my middle part of the lung. Now I can fill the upper part of the lung. 3 steps breathing. Sanskrit word, dirgha means long, shash means breathing, long breathing. Second practice. Third practice, Savitri Pranayama. Savitri Pranayama is 2:1, 2:1. Inhalation, retention, exhalation, suspension. Purak, Abhantarin Kumbhak, Rechak, Bajja Kumbhak. So let's start with first to say count of 6, 3, 6, 3, which will be very easy. So breathe out first. See, for me, I always do it with my eyes closed. When I do my eyes closed, I can clearly visualize my breath and I pay a lot of attention. I'm very relaxed. Breathe in with a count of 6 in. Hold for a count of 3 in. Breathe out with a count of 6 out. Hold your breath, count of 3. Breathe in with a count of 8 in. Hold your breath for a count of 4. Breathe out with a count of 8 out. Hold your breath in exhalation, count of 4. Again, practice Savitri Pranayama, very gentle practice. It has a profound cardiovascular effect. And you should want to read a little bit. I have a friend of mine, and he's like my younger brother. He's from Pondicherry, India. Anand Balayogi, very world-famous yoga teacher, yoga practitioner, and a Western-trained physician like me. He did a lot of work and published papers. Look at the effect of Savitri Pranayama on cardiovascular system. You can look at my guru. You know who my guru is? It's called Google. Google him, and it'll come up. Breath holding in inhalation, Abhantarin Kumbha. Breath holding in exhalation, Bajja Kumbha, with abdominal lock and a chin lock and a root lock. Mursha Pranayama. Mursha Pranayama, see, my hand already goes to Adi Mudra, but this is my daily practice. My brain is getting neuroplasticity. That's why I need to do it. So, breathe out first. Take a deep breath in hold your breath and slowly drop your chin down. Let the chin touches your chest. And hold your breath and keep counting. The way you count, 1 and a 2 and a 3. The Sanskrit name, Murcha Pranayama. Murcha is almost unconscious. It is so relaxed, you feel almost unconscious. It is a tool to even treat and improve chronic incurable diseases. Breath holding in exhalation, Bajra Pranayama. So breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. Abdominal lock with any band creates a profound negative intra-abdominal pressure and causes better perfusion of the intra-abdominal organs. We also recommend it for people with hernia. Because in hernia, when it gets pushed out with a positive intra-abdominal pressure and it creates a negative intra-abdominal pressure. In a mula bandh, do the same thing. Breathe out first. Take a deep breath in. Take a deep breath in. Completely breathe out. Pull your whole pelvic floor and inner sphincter up and hold your breath. You can use all the 3 locks at the same time, which is called your great lock or Mahabandh. I've lived with yogis and I find it out, no yogis will live home without doing your Mahabandh or all the bandhas practiced daily. So the practice is, again, breathe out first. Take a deep breath in. Completely breathe out. Contract your pelvic floor and pull up. Suck your stomach in. Drop your chin down, touch your chin to the chest. When you let go, remove the chin lock first, abdominal lock second, and root lock third. This is a practice which is definitely improve your lung function, pulmonary function. Like for me, I've been practicing for so long that if I go for a pulmonary function test, the normal parameters which are set there, I cross the normal parameter. So this is entirely normal when you're breathing practices. Alternate nostril breathing, Anulom Vilom Pranayama, followed by Nadi Shuddhi Pranayama. We did all the pranayama in the last class, which you've seen. So I'm doing a little bit of a pranayama, but showing you how to do improve the lung function. Again, with the left hand, touch your index finger and thumb, Gyana Mudra, put it over your left knee. Right hand, use your right nostril to close your right thumb to close your right nostril. Breathe out through your left nostril. Then breathe in through your left nostril. Close your left nostril and breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril. Breathe out through your left nostril. You continue your left nostril, alternate nostril breathing. Slowly you enter into the profound level of relaxation. Both the nostril opens up. Another thing which I like you to test, very important, we get a little drainage from both the nostril because we are doing the Jalneti in the morning. So this is another powerful practice you do every morning. You see the patency or openness of your nostril. By closing my right nostril, I'm breathing in and out through my left nostril. When I'm closing my left nostril, I'm breathing in and out through my right nostril. For me, both the nostril feels fairly open almost equally. I'm sure for your practice, you'll see your one nostril is more open than the other. That is entirely due to the imbalance we have in our physical body and mind. Why? I'm right-handed, right-footed. I'm always using my right side of the body, my left brain, or my left brain. I'm not using my right brain. So practice. How do you practice? Like practice, try brushing with your left hand. If you start brushing your left hand, what will happen? If you bring your hand here, the brush will be everywhere. You won't be able to come close to your mouth. And then start brushing your teeth. You know what will happen when you get there? Right hand will do like this. It's called neuroplasticity. Eat with your left hand. You know, make it balance with your health. Alternate nostril breathing brings a balance. Then you can progress with alternate nostril breathing because it is a very calming, cooling pranayama. You know, you practice at home with your very quiet environment, like a loose-fitting clothes what I have, and the environment I have now, put maybe a little music, and do an alternate nostril breathing. For us, in a daily, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. Out of 25 minutes of pranayama, maybe around 5 to 10 minutes of alternate nostril breathing. Then you bring a more awareness on alternate nostril breathing, and you also bring a balance. It's called a super brain yoga. Let me show you how to do it. You use again both the finger, middle finger and index finger. That is called your Vishnu Mudra. When you put it down, instead of Vishnu Mudra now, you put it in between your eyebrows. Close your eyes and bring your awareness in your third eye in between your eyebrows. Now you continue doing alternate nostril breathing. Close your right nostril, breathe out through your left nostril, and breathe in through your left nostril. Close your left nostril, Breathe out through your right nostril. Breathe in through your right nostril. Continue alternate nostril breathing. Within a short time, it will be a profound level of relaxation. Both the nostrils will be open. Next move, take your left hand, bring it up, and hold your right earlobe. Crossing your hand, holding the opposite earlobe, it brings a total balance. It's called a super brain yoga. Super brain yoga is holding the opposite earlobe and doing standing up and sitting down, doing sit-ups. And there is a lot of research, even in MIT, showing that it brings the balance. So this is bringing the balance, and alternate nostril breathing is bringing the balance. Balancing both sides of the brain. Our body's left side of the body is a female energy, right side is a male energy. It balances both sides of the male and female energies. It balances Vata, Pitta, Kapha. It balances our Prana, Teja, Ojas. It balances our Sattva, Rajas, Tamas. Everything gets balanced with your alternate nostril breathing. Powerful yogic breathing technique, which I recommend you to practice all the time, every single day. 3 breathing practice you should do every single day. Alternate nostril breathing, Anulom Vilom Pranayama, your Bhastrika Pranayama, the Bellows, and your Kapalbhati Pranayama, the breath of fire. You do a Nadi Shuddhi Pranayama. We have shown you one time. Let me show another time. And you'll be practicing in a quiet environment at your home. Use a Vishnu Mudra. Use your index finger and middle finger touching the palm. Use your 3 fingers, little finger, ring finger, and thumb as your pinch. And when you use the pinch, you'll be pinching the nostril to do the breath holding. Alternate nostril breathing with the breath holding. The first will be a breathe in for a count of 4 in, breath hold with a count of 16, and breathe out with a count of 8. Generally, I do with my eyes closed, and let me use my left hand to guide you. So here is my Vishnu Mudra. My right nostril is closed. I'm breathing out through my left nostril. Breathe in through the left nostril with a count of 4 in. Hold your breath with a count of 16. Breathe out through the right nostril with a count of 8 out. Breathe in through the right nostril with a count of 4 in. Hold your breath for a count of 16. Breathe out through the left nostril with a count of 8 out. One round of Nadi Shuddhi Pranayama. Now again, I want to show you something which I practice and let you know. My mouth is still wet. I have a lot of in my mouth. And think about it, for an hour and a half, I've been talking. I'm not drinking any water. I still have a parasympathetic activation. Let's do just one step more with a Nadi Shuddhi Pranayama. And I want you to practice at home in a very calm, quiet environment. I'm showing you the technique. Again, your Vishnu Mudra. Now let's do Just increase 1 more second. 5 in, 20 hold, 10 out. My eyes are closed, all the awareness to my breathing. I'm breathing out first through my left nostril. Breathe in through the left nostril with a count of 5 in. Hold your breath for a count of 20. Breathe out through the right nostril with a count of 10 out. Breathe in through the right nostril with a count of 5 in. Hold your breath for a count of 20. Breathe out through the left nostril with a count of 10 out. Another round of Nadishuddhi Pranayama, increasing 1 more second. So when you can do it effortlessly, you keep on increasing the number. And breath holding is one of the most powerful tools to improve your lung function, because it improves your gases exchanges when you do the breath holding. Bhastrika Pranayama. Bhastrika is a bellows. As you said, the bellows is we all city dwellers, we have never seen a bellows, but bellows is done inhalation and exhalation to blow your fireplaces. A blacksmith uses it. So basic technique is we keep on doing it so you can do it very simply. All the techniques we do at the beginning. So we have a 3 level of our existence. We call first a rogi, we have a disease. Without transformation of the yoga practice, we become nirogi. We have no disease. Then we become yogi and yogini, do yogic practice. So if I'm a rogi, I do Bhastrika Pranayama very gently, like this. Continue this. Or you can do hand raised. Very simply raise your hand high up. Breathe out first, take a deep breath in. When you breathe out, you drop your hands down like your Adhimudra. Let's see if I can show you a little bit from the back. Then for a nirogi, a nirogi can do in different speeds of Bhastrika Pranayama. So what you can do, so we'll just demonstrate, say a 3 levels of Bhastrika Pranayama, very slow. It is called Ishwar. Ishwar. When you bring it down, we should bring it down with a Adhimudra. Ishwar. Then the next speed will be so hum. So hum. And finally the final speed will be your Vishnu, Vishnu, Vishnu. This is also based on your Ayurvedic yoga therapy, based on your doshas. Kapha will do very faster, Vata will do very slow and rhythm. So let me show it to you. 10 counts of slow, 10 counts of medium, 10 counts of fast, and we do a cycle. Generally, we do 20 counts of slow, 20 medium, 20 fast as a one cycle. And you continue the cycle, 2 cycles, 4 cycles, 6 cycles, 8 cycles, and depends. As long as you don't have any effort, you continue. So let me show you just one cycle with a count of 10, and you can slowly increase on your own level. So this will be very slow-ish one. My eyes are closed, and I'll follow my breath. Second, medium speed is called so hum. On the count of 10. Third one will be very rapid, sequence called Vishnu, count of 10. You will have some mucus will come out from your nostril, which is entirely normal. We distribute in our class a box of Kleenex, and it is better because both the nostril opens up. And very important yogic practice, raising your hand and pulling it down. When pull it down, be sure you pull it down as a yogic fist. What I do, I just want to be very relaxed, comfortable, and I see I'm very relaxed, before I do. Set up your count, maybe 10, increase to 15, slow, 15 medium, 15 fast, and do a few cycles. You will have an effect of hyperventilation. You will have an altered sense of consciousness. You will have a little bit of your circumaural numbness, carpopedal spasm, but it's normal, entirely normal. Don't get panicky when you get the symptoms, but always try to do effortlessly. Kapalbhati Pranayama. Kapal is the forehead, Bhati is the shrine. So you bring your awareness to your belly button, push your belly button in the back, as I demonstrate to you, hit the diaphragm, hit the lung, air will come out. Any message of the organs is a healing practice. So in between the lungs sitting heart. So we're also massaging your heart very gently. And always remember, so what I want to show you again, that when you're sitting down at one point, always try to cross your leg and sit it down. If you have if you feel any unusual thing, remember, we don't ask you to sit in one posture. Only asana for a pranayama practice is your sthiram sukham asana. I'm showing it to you just to get the idea that it is not written in stone that you have to be in a Padmasana. I get so many. I cannot sit down in a Padmasana. Can I do a pranayama? Yes. You sit down in called sthiram sukham asana. Cross your leg to be sure you're balanced on both sides. Okay. So in Kapalbhati Pranayama, you're bringing your awareness here. Bring your awareness. And let me do with my feet in front. So I want to show you the different way. Or put your hands so you are comfortable. Sukham. Also, many a time I keep my spine straight, sit down in a chair. Chair is very good. Or I go to the back. I put my back supported. I don't go all the way to the back. To show it to you, I can go ahead and support my back in the sofa even. I can do it. I sit down against a wall to support my back. And I put down my feet according to my comfort level. Sthiram sukham asana. So when you do this Kapalbhati Pranayama, you also do the mudras. 5 to 8 mudras. This is your Jnana Mudra, Vayu Mudra, Shunya Mudra, Prithvi Mudra, Vayu Mudra, Varun Mudra, Shakti Mudra, Apna Mudra, Apna Vayu Mudra, Linga Mudra, Chin Mudra, Chinmay Mudra, Adhi Mudra. And these are all described in my book and also in my DVD, which is available in YouTube. You can see it very clearly. So the Kapalbhati Pranayama, what you do, you start with the mudras and do a count, 10, 20 in each mudra. I generally do 50 in each count. I generally do between 5 to 10 minutes again in Kapalbhati Pranayama. I do around 500 to 1000 count, but I'm very quietly, gently. So I'm showing you the technique. I'm not breathing in. All my awareness is here. I'm just only breathing out. Breathing in is automatic. The day I was born, I took a deep breath in. Nobody taught me how to breathe in. I learned how to breathe out. So I do this and continuously. And I change my mudras. You can do it with me also. But let me tell you, it massages all the internal organs. Massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your colon. For female, it massages your uterus, your tubes, your ovaries. Very good for women with their infertility, because it massages the organ. For men, it massages your prostate gland. It also massages your lung, massages your heart. Then you do again, by the time you close your eyes, you have a Shunya Mudra. Prithvi Mudra. Varun Mudra improves your bladder function for stress incontinence. Improve your fluidity in your body. Shakti Mudra improves your strength in your body. Adhi Mudra, Pachan Mudra, digestion Mudra. Linga Mudra. There are a lot of other mudras which you do. You know, you have seen all the time when I was talking, my hand becomes like this. This is called your Hakini Mudra. It's for concentration, touching the tip of each finger. This is called your Shankha Mudra. Wrap your hand around the thumb, touch your index finger. This is Shankha Mudra. It removes your anxiety. You know, like close your eyes, you can do it. Wrap your right hand around the thumb, left hand around your right hand, touch your index finger and thumb. This is your Shankha Mudra, Kangshan Mudra. Dhenu Mudra balances both sides of your brain. Touch your, I'm doing all my eyes closed because I'm so comfortable doing right index finger to the left middle finger, right middle finger to the left index finger, right ring finger to the left little finger, right little finger to the left ring finger, touch the thumb, alternate fingers touching, balances both sides of your brain. So it's a beautiful practice when you do this pranayama with the mudras and with the relaxed, physical body. It's a wonderful practice to improve your lung function. So we'll finish shortly. Let's finish. We'll do with your Brahmari pranayam, the Ujjayi pranayam. We'll finish with the Om pranayam. Again, we'll show you the techniques. But at home, you do it a little longer and longer. In a Brahmari pranayam, you put your index finger in the forehead. Use your 3 fingers to close your eyes. Use your thumb to close your ears and close your mouth. You breathe out through your nostril. Breathe in through your nose. It totally shuts down your 5 senses, called pratyahara. Then you bring a vibration which has the same frequency as your brain, called harmonic resonance, quiet down your brain. Powerful tool to quiet down your body and mind. So you breathe better, function better. It removes your anxiety, fear, and panic, improves your immunity. Ujjayi pranayama is very important. Ujjayi pranayama is able to close your throat, try to breathe in. And the closing is totally relaxed. As I explained to you, it stimulates your vagus nerve through your superior and inferior laryngeal nerve. 80% is a input, and the output which comes out through cranial nerves, it tightens up your glossopharyngeal and palatopharyngeus muscle to tightens up your soft palate, so your snoring is reduced, and it pushes the tongue in front through a hypoglossal nerve. Your sleep apnea gets better, you breathe better, pulmonary function improves. So the technique again is breathe out first. Take a deep breath in. Completely breathe out. Again, little bit of a cough. That means you are hitting your larynx, because that's where the cough comes from. Now, initially you can do little bit of a burst of your Ujjayi pranayama, like this. You can do It massages your thyroid gland. It's good for your thyroid gland. It improves your pulmonary function tremendously. So practice this. Ujjayi Pranayama. Sitali Pranayama and Sitkari Pranayama. Remember, you always breathe through your nostril. God gave your mouth to eat and to talk. What happens to your nostril? When you breathe the air in, the air gets filtered with all the hair inside your nose. And nose is your personal air conditioner. Outside air is cold, it warms it up. If it is warm, it cools it down. Then the side of the nostril has a organ called your turbinate. The turbinate directs the air, so it goes into your lung. So if you breathe in through your mouth, you don't know where the air has gone, whether it's gone to the esophagus, in the stomach, or in the lung. So when you breathe in through your nose, all the air goes into your lung. And breathe out through your nose, all the air comes out through your nostril. Now somebody comes to me and says, listen, I have to breathe through my mouth and I cannot go all through my nose. So if you breathe in through your mouth, you don't know where the air has gone. So breathe in through your nostril. And you can breathe out through your mouth. That is more physiological. But we breathe through your mouth to cool down our body. That is not for your breathing, it's a cooling pranayama. You need cooling pranayama to improve your lung function. Sitali pranayama. Roll your tongue out, breathe through your tongue, close your mouth, breathe through your nostril. Within a few breaths, your whole inside gets cool. Very good for women with hot flashes, with like a gastroesophageal reflux, counteracting inflammation, counteracting with pitta. Somebody said, I cannot pull your tongue out. And you can do through your teeth, called Sitkari Pranayama. Breathe through your teeth. It's a wonderful practice. There's a lot of other pranayamas you can practice to improve lung function, but let's finish with called Om Pranayama. Om has a frequency which is the same frequency as your brain. So two frequency interacts, quiets down, and it quiets down your mind. So let's finish. We'll do with the 3 Om Pranayama. Nice way to do it that if you can do with your Padmasana or a lotus pose. Lotus pose is very nice, a relaxing pose. In yogic Om, the Om has a 3 component, A-U-M, A, U, Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. So we'll do 3 Om Pranayama to finish. Then we'll finish with the palming and cupping, which is a very powerful yogic practice. Use your hand, touch your index finger and thumb, put it over both the knees. Close your eyes. Breathe out first. Take a deep breath in. Slowly bring your both the hands in front of you. Touch your little finger and thumb. This is a Padma Mudra. Lotus Mudra. It connects your body, mind, and spirit. Slowly bring the Padma Mudra close to your heart. Heart is the site of your soul. Heart connects through your mind. Heart and mind is totally connected. We always say, memorize by heart. Yoga practice gives us physical wellness, mental wellness, and spiritual wellness. Physical wellness gives us strength and stamina. Mental and spiritual wellness gives us health and healing. Slowly bring your hands in front of your heart chakra, Anahata chakra. Put your hands together, bow your head down, and it's called Namaste. Namaste is the honor. I honor the divinity within you. This day of coronavirus, social distancing, and self-isolation, greeting a person with Namaste is the perfect way. Slowly you rub your hands, you rub your hands, rub your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses, take your hands like a cup, put it over the eyes like a cup, slowly massage your forehead, massage your eyes, massage your face and head and neck. This is a very powerful yogic relaxation and gesture. It's a wonderful class, over 2 hours. And again, I want to emphasize, at the end of 2 hours of my talk, I still have a saliva in my mouth. My mouth is still wet. This is called your parasympathetic activation. Also, another finishing, this day and of age, the honoring our soul and your, in a public place, to honor the divinity within them. We do it both in East and West culture. Put your hand over your heart. This is a very nice way of honoring. Instead of a handshake, this is a nice gesture. Thank you again. Namaste, and see you next week. Probably we'll continue our saga with coronavirus. With this yoga practice, we can say it is almost a money-back guarantee that improving your health, improving your lung function, you are able to fight coronavirus today. Thank you.